welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I'm going to talk about the POISE 3 trial and how it has a much wider use of tranexamic acid in non-cardiac surgery. Perioperative bleeding is quite common in patients who are undergoing a non-cardiac surgery, and tranexamic acid is an antifibrinolytic drug that may safely decrease such bleedings. Tranexamic acid is indicated for heavy menstrual bleeding and hemophilia and has been used in cardiac surgery, but it is increasingly being used in non-cardiac surgeries as well. Now, as previously reported, POISE showed that the beta blocker metoprolol lowered the risk for myocardial infarction, but on the other hand also increased the risk for severe stroke and overall death. Whereas in the POISE 2 study, perioperative low-dose aspirin, it lowered the risk for myocardial infarction, but was linked to many more major bleedings. But now, as I talk about this particular trial, a single dose of tranexamic acid at the beginning and end of a surgery significantly reduced major bleeding in patients who are undergoing non-cardiac surgery compared with the placebo, and these are all based on the findings from the recent POISE 3 trial that was presented at the American College of Cardiology's 2022 conference and simultaneously published in the New England Journal of Medicine. The study randomized close to 9,500 patients who were undergoing non-cardiac surgery at 114 centers in 22 countries to receive 1 gram of intravenous bolus of tranexamic acid or placebo at the start and end of the surgery. The primary efficacy outcome was a composite of life-threatening bleeding, major bleeding, or bleeding into a critical organ at 30 days. The primary safety outcome was a composite of myocardial injury after a non-cardiac surgery, non-hemorrhagic stroke, peripheral arterial thrombosis, or even symptomatic proximal venous thromboembolism that was shown at 30 days. The overall results of this trial showed a composite bleeding outcome event occurred in 9.1% of those patients in the tranexamic acid group compared with 11.7% of the patients in the placebo group. Hence, it was noted by the researchers that the benefit of tranexamic acid treatment was consistent regardless of the type of non-cardiac surgery that the patients received, and whether such patients who received non-cardiac surgery, hemoglobin was considered normal or low before surgery. The authors hence observed that there was an unequivocal benefit of treatment with tranexamic acid on preventing bleeding and blood transfusions with no increased risk of complications. Now, given the number of people worldwide who undergo non-cardiac surgery every year and the frequency of post-surgical bleeding complications, this has shown to be a potential to help a lot of patients. That's all for today. Stay tuned to Medical Dialogues for further updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.